Is pandemic fatigue setting in after nearly a year of lockdowns around the world? Have many simply lost patience with social distancing and other safety measures? And is the virus going to spread more rapidly during the coming northern winter? This is Inside Story. Hello and welcome to the programme. I'm Imran Khan. With no end in sight for the coronavirus crisis, governments are warning of pandemic fatigue. Protective measures are being flouted and more of us are dropping our guard. And that, health experts warn, threatens yet another resurgence in infections. Until a vaccine is developed, social distancing and mask wearing remain critical in containing the virus. But after months of lockdowns and disruptions of normal life, many people say they're simply exhausted. The World Health Organization's Regional Director for Europe, Hans Kluge, said, "I believe it is possible to reinvigorate and revive efforts to tackle the evolving COVID-19 challenges we face. It is essential that we respond together and that communities own response policies with authorities. By balancing science, social and political needs, we can develop precautionary measures that are culturally accepted." The latest virus wave has been particularly strong in Europe. France has introduced a nighttime curfew in 9 cities that will last for a month. It has also limited gatherings to 10 people. In Spain, a 15-day state of emergency is in force for the capital, Madrid, and surrounding areas. Leaving or entering the city remains banned, except for essential purposes. Germany's ban on large gatherings has been extended to the end of the year in some parts of the country. Anyone failing to wear mask coverings in public areas faces a fine. And England has introduced a 3-tier system of local lockdowns. On Monday, the First Minister of Wales announced a 2-week lockdown scheduled to begin Friday. Let's bring in our panel. Joining us from Manchester in England is Peter Kinderman, Professor of Clinical Psychology at the University of Liverpool. In Geneva, Switzerland, Dr. Annie Sparrow, Professor of Population Health Science and Policy at Mount Sinai Hospital. She's also an emergency and critical care physician. And from the Greek capital, Athens, Ulrich Brueckner, the Jean Monnet Professor for European Studies at Stanford University in Berlin. Welcome all to the programme. Now, let me begin with Annie Sparrow first in Geneva. Annie, I'm fed up of wearing a mask. I'm fed up of not seeing my family. I'm fed up of not being able to get on a plane and go somewhere. I'm just fed up of this whole thing. I'm fed up of the tests. Who am I trying to blame here? Am I trying to blame the governments for their lack of handling, the WHO for bad advice? Where is the blame here? Is any one organisation to blame?
Oh, don't we wish? And I think that's part of the problem, isn't it? That we spend more time blaming and obsessing and, not just politicizing corona, but totally pathologizing the science even, so that, even when we do have the evidence, it's too politicized and we don't really care anymore. And in the US, for example, science is simply a prop for, it's a political prop, and it's become an evidence-free zone. And that's one of the issues, that we've lost faith in the CDC, which is also been dominated by politics, and WHO is often held hostage by member states who don't want to give the data. And we've seen that very clearly, and we've seen that from the very beginning with China, with its long delay in reporting, its long history of cover-ups and lying, and yet WHO's primary role is coordination. So fundamentally, it can't actually begin that process by alienating and castigating arguably the central figure. So of course, we're all fed up, and we've been living in this state of limbo now for 9-10 months. And that's the problem, isn't it? We can't see the end in sight. And I think one of the most distressing thing is, or disturbing thing is, actually there is an end. We do know how to control it. We can control it. If we stop actually treating tests as simply a marker of disease, and actually think about how to look for whether or not people are contagious or not, then you don't have to wear a mask anymore. If we could actually turn tests into a test not for COVID itself, which at the moment we use PCR, which is a pretty binary measure which says you've got it or you haven't. but it detects dead RNA, dead viral fragments in your nose and mouth, as well as alive. So whether you're dead or alive, PCR doesn't necessarily discern whether you're 2 days into the infection or 35 days into it. So it's not a very good test. In fact, it's a terrible test for contagious disease, which is actually a much shorter period of about 7 or 8 or 10 days maximally. And what we need to do is actually transform all those rapid tests into tests of contagiousness so that we can do those every day at home. And that'll be the new mask, but that'll give us back agency and control over our lives. So you take that test every day, and if it's positive, then you self-isolate, and you keep self-isolating until your test turns negative again. And then you can build that level of confidence into the workplace, into homes, into schools, into airports, and we can have our lives back. That's what we need.
I mean, I don't think we get our lives back. I mean, you are talking about a change in lifestyle. I mean, if we're testing every day, that's not our old lives back. Ulrich Brueckner in the Greek capital, Athens. I mean, is there a way that we might get our old lives back?
Well, I must say I'm positively surprised when I look at the German discourse, how our lives have adapted to a new normal. And it's not about a blame game. It's not about not having anything what one can do in a similar way as in the past. But people do adapt, and people do what one could call social learning. We see that board games spending gets up 20%. People spend time together in an analog way. People learn to wear masks, which was not at all a thing in Germany other than in Asian countries. And we never had a situation that the government pretends to know better or to enforce things on the people, and rather try to communicate how little they know, and that the trial and error in close cooperation with scientists is what the strategy is about. And that is much better than I personally would have thought 9 months ago how the whole development goes.
Annie Sparrow, we are in this situation where it feels like, not just me, but the entire world is in one massive science experiment, that we don't really know where we're going with this. It's like Ulrich says, it's trial and error, isn't it?
Well, it is. We've never had to do this before. We really haven't. I mean, SARS, way back in 2003, affected only 29 countries, didn't travel as fast. It never actually reached, Europe or the United States. It only really reached Canada and Toronto at that. Ebola, which was scared us all silly, actually, of course, is bloodborne and doesn't travel in anywhere near the same way. Swine flu was very, very manageable. We don't know the mass of this virus. We don't understand it. We finally sort of are learning that it's not only transmissible 2 to 3 days before symptoms appear, if symptoms appear, and when symptoms do appear, they're mild, undifferentiated, fever, cough, headache. It's undifferentiated from flu, from common colds. We're approaching winter season, but meanwhile in the southern hemisphere or in, of course, sub-Saharan Africa, that's the same symptoms I see in malaria patients. So we have a virus that has very similar symptoms. It transmits asymptomatically, and most people who actually get it don't even transmit onwards, which makes contact tracing a bust. Most of the spread is in the community, in places of congregation, poor ventilation, incarceration, nursing homes, prisons, pubs, packed clubs, restaurants, and that's how we actually have to take our cue from the virus and actually figure out how to test for contagion when so much of the contagion is happening when you don't have symptoms. We can't use fever as it's useful as optics, isn't it? But it's just theatre, because by the time symptoms appeared, you've already probably infected people if you were going to, and you've missed the boat. So yeah, I think we are living in a kind of science experiment, and worse still, some of this is even exploited in the same way that China last week rolled out millions and millions of testing in a city of several million. And you think, are they doing that are they using that city as guinea pigs for a new test, or are they using it as a kind of broader laboratory for surveillance and social control? We're seeing all these apps being rolled out. That's a big hit of COVID, isn't the contact tracing apps, and yet there's no evidence that they exist, that they are useful whatsoever. And meanwhile, we're just subordinating people to the actual virus when we need to think about putting people at the center of it, because yes, we're all fed up. I mean, first few months, I also became a brilliant cook, and now we're just longing to actually connect and put our kids back in school, who've actually, I think, are the biggest victims, the least infected but the worst affected. And that's probably the biggest catastrophe of this entire pandemic, and how we've managed it according to the influenza playbook. But this is COVID. This is the COVID playbook.
Peter Kinderman, you're a professor of clinical psychology. We are living in this kind of odd science experiment where we are trying to figure out our way through this pandemic, but it's not just a science experiment, isn't it? This is having mental health issues on an unprecedented scale. And I use that word deliberately. There is no precedent for this, is there?
Well, I'm not so sure. I think there are some precedents, both in recent history and a bit longer. So one of the things to remember here is that human beings do actually respond quite well to crises. We respond well as communities, and we respond well over time. We have evolved to work together as a community in order to survive droughts and floods and the predations of wild animals and insects. So we as a species are quite good at coming together and responding to external challenges. I think we also have had the precedent of the 1918 influenza pandemic. And so we have learned about some of the social challenges, the social changes and the behavioural changes that people need to make in order to keep safe. Witness, for instance, the way in which different American cities in 1918 either did or didn't suffer major second waves of infection. So we can learn from the past, and I fear some of our politicians are not so good at learning from the past. I think the other thing to say is that we're incredibly social, we're incredibly cooperative, and we're incredibly inventive animals, humans. And so Ulrich is right, people learn to adapt. I think that the difficulty that we're having at the moment with the response that we need to make to this pandemic in order to keep us and those people that we love safe is not so much fatigue as the fact that we need our political and economic systems to support and not frustrate the changes that we need to make. So I think that we would all be relatively good at sticking to rules if we knew what the rules were and why they were being introduced and it was explained. And certainly in the UK, we've got quite a chaotic evolution of rules. At the moment, I live in Greater Manchester, and the Mayor of Greater Manchester and the Prime Minister of Great Britain of the United Kingdom are in some dispute over what the rules should be in Manchester. That's not a good recipe for people following the rules. And economically and socially, we need our education system, our business arrangements, the way in which we're paid money, in my case, the way in which I work, to support the necessary changes that I need to make in order to keep myself safe and not frustrate them. So I'd rather we didn't look at individual fatigue or frustration, but more about how governments can take major steps to make it easier for us to protect ourselves.
Now, you mentioned 1918 there and the flu epidemic. The one crucial difference between 1918 and 2020 is social media, Facebook, Twitter, that sphere of information that's free-flowing, often can be wrong. People can now go and find anything they want that backs up their argument, and they can even say, well, you know what, masks don't work because I read something on social media. We're in this bubble right now where people are in echo chambers and simply, because of the confusing advice coming from many governments around the world, are seeking their own advice, and we're getting even more confused, aren't we?
Well, again, social media is undoubtedly a phenomenon of our time. The internet and connectivity is a phenomenon of our time, but that's both good and bad. So, if there were new rules for the best way to protect myself and the people that I love brought into force right now, where I live in Greater Manchester, I could find out about that almost instantly through social media. And our ancestors in 1918 didn't have that functionality. If we have clear policies that will support us economically and in our lifestyles brought out by government, those can be enacted and people can be informed about them extremely swiftly because of the connected world that we have. We can even adapt to very much isolated behavior. So we can interact through social media. I did a wine tasting on Facebook only on Friday night. So we can do things to sustain our lifestyles in a positive way using the connectivity. Yes, idiots and people with malicious motives can use social media to spread disinformation, but directors of public health, local authorities, governments, and professional organisations, the National Health Service, can also convey useful information rapidly. And I think that on the whole, as Ulrich said, people are willing to learn, to adapt, to absorb information. So I think that on the whole, the connected society that we have now is probably an advantage to us relative to 1918 rather than a disadvantage. I think, however, we could do some better work on making sure that accurate information is portrayed across social media. That would be a good thing.
I mean, the interesting thing that's coming out of this conversation is all three of you are actually agreed on the fact that this is a long-term thing, that changes need to be made long-term. But that's going to have an impact. Dr. Annie Sparrow mentioned children. I want to begin with you, Ulrich Brueckner, in in Athens. It is going to be a generational change for children, and that has to have a long-term impact.
The most sensitive point when we look at the different pockets of society seems to be schooling and homeschooling in particular, because it's a major challenge for families that are not at all prepared for this, not to speak of the infrastructure of schools, even in a rich country like Germany. This is where I hear the most complaints. Everything else, like adapting lifestyles and also thinking in bigger terms, like when we look at plague, for example, this has always been part of the European history that came with trade routes. It was a natural phenomenon. And when you look at places like Venice, they knew how to live with international trade and the fear of being threatened by a pandemic. But when it comes to children, to adapt from now I learn what school is as a elementary school kid, and now I have to do everything in some sort of a self-organized way, or to have parents who can replace teachers. This is a major step, and I'm afraid some of them will lose more than a year in their education.
Dr. Annie Sparrow, do you think governments are prepared for this generational change that's going to have to happen, particularly when it comes to things like schooling at home and parents having to get involved?
Absolutely not. The way that schools were shut down was not informed by science. I mean, when we looked at all the earliest data, we could see right from the beginning, in real time, that children weren't being affected. And if they were being infected, they weren't being affected. Now, this is a cause for really global celebration. If it were like influenza, which afflicts young children, teenagers, pregnant mums, then we would be globally heartbroken right now. That we would have, more than well over 1 million deaths, and so many of those would be our children. So we are actually, incredibly lucky that in that, it's not, of course, that our elderly are dying, but that our children are not, which are our hope and our common future. And this is why we need to all actually get behind children globally, because individual governments are not prepared. They often just followed each other as a domino effect, where they said, well, I did it because everyone else was doing it. Very, very few. Only Sweden, didn't close its schools, as we know, through age 15. Germany also never closed its daycare centres. And we have some data which actually says those are safe places. Teachers at primary and schools up to 15 and daycare centres had a lower risk. It's protected, to be more around children. We don't understand a lot of this yet, but what we do know is that we have made children forego their education in the interests of stopping community transmission, when schools are actually not a place of major transmission at all. And we know that. So meanwhile, now we've had up to 1.6 billion children out of school. We still have nearly 600 million, and more than half of those are girls. And we know that there are going to be another 500,000 child brides this year, because many girls are not ever going to return to school. We're losing them. We've seen, some of the problems with mental health, with physical health. You can't just tell a 6-year-old, an 8-year-old, a 10-year-old can't just learn online. And even if they can, then we have to remember that 500 million kids don't have internet, are not connected, and even if they are, actually, schools are very important places of connection physically with, and it's not just education, is it? It's the connection with friends, it's the social development, the emotional development, the physical activity, the services that are provided at schools, whether they are in speech, in disability, in children with learning challenges, it's sports, it's all of the things which are critical to actually learning how to interact and be a part of this world.
Well, let's explore that with Peter Kinderman a bit. I just want to bring him here. There is, I mean, this is anecdotal, so just bear with me here. But when China had its one-child policy, what it was finding was there was a whole generation of kids growing up who were very selfish, so China relaxed. Like I say, this isn't scientific, this is anecdotal. I'm just trying to explain how I understand it. So China relaxed that policy. When you did your wine tasting on Friday night, you remember what it's like to actually physically be somewhere and be with your friends and all of that. But now we have this generation who are going to be doing all of this online, who are going to be doing all of this digitally, who don't have the benefit of remembering what it was like before. That has to have a significant impact on society, no?
I think these things are going to have a major impact on society. I think it's going to, the pandemic is a fearful event, and then also the economic consequence is going to have a major impact on our society, particularly on our young people. What isn't anecdotal is that levels of anxiety and depression are already rising in our young people. There are already pressures on mental health services, and we're already seeing a regrettable, in my opinion, increase in the prescription of psychiatric medication. And I think that it's inevitably going to have that sort of impact. I'm not sure that we can say at this stage whether the disruption to schooling or the focus on less interaction between children is going to have one particular effect on their development or another. But I think you're right in suggesting that the impact on our young people is going to be particularly severe. Generally, this is going to have a major impact on our psychological well-being. I would, however, say that we shouldn't, in my opinion, respond to this by focusing too much on the individual and errors made by individuals or changes in personality to individuals, or indeed focusing on mental health problems in individuals. We need to think about this as a collective issue about what will happen if there are widespread redundancies, if there's a major drop in production, if there are major changes to the economic infrastructure, and if there's major disruption to a generation or two, a cohort or two cohorts of children going through schooling. And we need to think about it in the community terms rather than focus on the individual. And like I say, I'm concerned that we're starting to see an increase in the rates of psychiatric medication being prescribed, because that indicates that we as a community are focusing on the suffering of individuals. And I think we need to have our mind focused on what we can do collectively as a community and a society to protect ourselves and each other and to continue with a well-ordered society, rather than saying that individuals are fatigued.
Peter, sorry, we are running out of time, and I do have a question for all three of you, actually, that involves that. Like you say, we are talking about the idea that things are going to change significantly, and that needs to be dealt with on a community level. Let's begin in Athens with you, Ulrich Brueckner. Is it time for a global pandemic summit where everybody gets involved, like every single government? So far, it seems to be haphazard. Each government is doing something slightly different with slightly different domestic agenda. Is it time for that to come to an end?
Well, of course, it would be great if we have a global challenge, that we have global institutions that can cope with it. Given that we have rather the opposite trend in recent years, that multilateralism got very much demolished and lost reputation with all the stories of my nation first or a multipolar world, it's not very likely that it's happening. What we see in Europe instead is a much stronger coordination and also practical forms of solidarity on a European Union level for those who understand that supranational solutions are way better than national.
Sorry, Ulrich, I do want to get to the other two. We are actually running out of time. Very quickly, Annie, Sparrow, do you think it's time for a global response?
If we could, I don't think it's going to happen anymore. I think, yes, we can have coalitions of the willing, which Europe can demonstrate. It is, we can take our cue from countries with female leadership, which have demonstrated the best control, and that's something to a very clear message.
Let me go to Peter now, just before we do run out of time. Peter Kinderman, what do you think? A global response?
Absolutely, if we can. But like the other two have said, we've got isolating governments. I'd quite like a coherent national response, to be perfectly honest. Global would be better. I'd settle for just something coherent at the national level.
I want to thank all our guests, Peter Kinderman, Ulrich Brueckner and Annie Sparrow. And thank you too for watching. You can see the programme again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. And you can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Imran Khan, and the whole team here, bye for now.